nail beds, because a lot of bacteria can grow under these nails. So as a nurse, as that nurse that you have, wash their hands before they go to dinner. Go in and get a clean washcloth, wash their hands off. Look at their nails, clean them. They have the little orange sticks that you can clean under their nails with, and you can trim them if they're not a diabetic. We don't want to do any trimming if they are a diabetic, but you can file and just make sure you don't get close to the skin and cause a breakdown of the skin by just filing them. But you want to look at their nails. And I don't know about, I just think my dad, once I do his nails, first of all, he relaxes when I do it. I'm sitting there playing with his hand, then I always put a little cream on his hands afterwards. And I think it just calms him down and it gives him the contact with him. And as your nurse as well. And I think it just helps them to relax sometimes and know you care. Once I do that, I check my nail beds as well. They should be nice and pink. I can see she's well oxygenated here with her cap refill and that. Then I'm going to, and I check the other side as well. I would do cap refill on her side, this side as well. What a pretty ring you have, Rebecca. And so I'm checking here as well, checking here, and then I kind of look between her fingers, especially if she's a diabetic, and just want to make sure I'm not missing anything as far as that's concerned. Now I'm going to check her pulses. I'm going to check radial pulse. We're doing just for presence and strength radial pulse, right? I find that, see it's a +2. I'm going to go up to her brachial pulses here, +2 as well. And again, I showed them how they can find their brachial back here as well, okay? So I can see that on her upper extremities, everything seems to be intact and well. Her skin looks good as well. We could do, at this point, do our range of motion with her. And remember, our range of motions is active and passive. It is ARON, that's your abbreviation that you use in your nursing, and PRON. If the patient can, Rebecca, can you put your hand, lift your arm all the way above your head? Okay, and down. And one more time, please. Good. That is 100% active, right? If Rebecca can come here, and then she goes, ooh, that hurts, right? I really don't want to go beyond her pain. But if she says, my arm's heavy, I can't go any farther than this. What would you say out of 100%, where would she be? 40? Okay, and so now I'm going to say, well, let me see. Tell me if you have any pain. Okay?
Right there.
Okay, so I'm stopping here. So I have 40 at active, and where am I at passive? Here's 100.
60.
Yeah. So I would say then your passive would be 10%?
60, yeah. Oh, okay.
10 is passive, right? Out of 100. That's what she can do. All right? And then we're going to, we take her arm and we have her cross it over her chest, right? And back. And then out. And then over her chest again. Feel this one. And here. All right? And her elbows, you know, she can go up here and down. I want to see if she can take her wrist and can you turn it this way? Back and forth. You take your fingers and go like this for me as well. Good. All right. I didn't forget any time. Good. We're just talking here.
And we'll do the same with you.
And you do it both sides, all right? And you should know the terms of what those are. Okay? Now, from there, I'm going to move down to our lower extremities. Are you still comfortable, Rebecca?
Yeah, actually, I'm at a 1.
You're at a 1 now?
Yeah,
Oh,
it's
good.
going down. That pain is working.
That is great. Now, oh my goodness, I think we should call a doctor. She has,
Black too.
yes, so good. She has some purple toenails. Anyways, so first of all, I'm going to check, I'm just going to inspect. Again, I'm looking at her legs. Tell here, all right. I see that she has one little sore there in her leg as well. Small. And it's a little red, so that tells me inflammatory process is working and it's in the healing process. I see some freckles on her legs, so she spent some time out in the sun this summer. And I see that,
Still my tan line?
yeah, you still have your tan line, a farmer tan. Is that what it is?
Flip-flop.
I see that she has no, just looking, I don't see any, this looks questionable, but when I palpate, I'll find if that's some edema for standing on her feet. I look at her knees. Now, the other thing that you want to check is the joints, and I think I didn't really spend much time on those with you guys. But, you know, a lot of us older people have arthritic knees, And so you will see sometimes these knees, when you look at them, they're huge, okay? And so that is arthritis that's in those knees. And sometimes those joints are really sore, and they get stiff as well. Excuse me. This is what we're talking about. So look at their knees as well, all right? And I'm looking for color. If Rebecca has, there's two types of problems. You'll learn two types of disease process going on sometimes in your leg, arterial and venous. Arterial, if they have a problem, arterial, remember, that brings blood, right, and so you have warmth with that, and you've got your nice pinkness. That's telling you have adequate circulation. Your venous is what takes it back to the heart, right? And so sometimes what you'll see, if the heart isn't working, like CHF or something, it can't pull this back. So you'll see edema with that. But with that, if they have some of these problems, you'll see a different color of the legs as well. And you'll see that her legs are a little pale looking to me, not real bright pink, but not bad. And and that I see that she must have had some kind of flip-flop or something where she has a
My tan line.
yeah, UTM line. All right. And so other than that, I see that she's got hair in her legs, so I know she has adequate circulation. People who have decreased circulation a lot of times, especially chronic, you will see, especially men that have these nice, well-shaven legs, it looks like, but they have lost their hair follicles have actually died because of lack of oxygen to them, and now they have these smooth legs, and they have, their skin can be real shiny as well. You can see multiple colors due to venous or a arterial problem. Arterial, usually they got blood flow to it, so they're usually pink. But you can see all different colors, purples, reds, kind of maroon colors, wine colors, whatever, when you look at some of these with some of the different conditions.